So this is one of the history-taking stations where the scenario is to speak to an 11-year-old girl with recurrent loss of consciousness. So let's see how the candidate performs.
Okay.
Yeah. So you are in front of a station, a history station.
Okay.
There is a 11-year-old 11-year-old Mary. Okay, 11-year-old Mary is complaining of syncope. Okay, recurrent attacks of syncope, and the GP has referred the child to you.
Okay.
You're a pediatrician.
Okay.
You're basically an ST3 trainee. You're seeing her in one of the clinics, rapid access clinics. Okay. So gather history from Mary and find the cause for her syncope.
Okay.
Yeah, so that's your station.
Okay.
Okay. So Mary, 11 years of age, recurrent attacks of syncope,
Okay.
loss of consciousness.
Okay.
Yeah, it'll be loss of consciousness. So recurrent attacks of loss of consciousness.
Okay.
Okay.
Yes.
Yeah, fine. So try to make a note of within yourselves what you would be asking, and how would you approach this case, and how would you even manage.
Time's up. You can, if you're ready, you can now enter the station.
Okay. Start.
Yeah, you can now enter the station. Yeah.
Hello. My name is Dr. Safia. I'm one of the GPs that's been assigned to you today. How are you doing?
Yeah, I'm okay. Yeah. How are you?
I'm great. Well, I believe. What may I call you?
I am Jessica.
Jessica, right? So, Jessica, I believe you made this appointment because you would like to discuss some problems you've been having recently. Is that true?
Yeah. So our GP referred us to you guys. Yeah.
Right. So, what's been written is that you've been having recurring losses of unconsciousness. Is that am I right?
Yeah. So Mary, Mary's having recurrent. She passes out, and I'm quite worried, doctor.
Right. And how are you related to Mary? Are you her mother?
Yeah, I'm her mom. Yeah.
Right. So, may I ask, can you please tell me in details what exactly is what the issues she's facing are?
So yeah, you can ask Mary as well, but I'll narrate for now.
Right. Can
Yeah.
Mary talk? Like, is she able to express herself? So, Mary, do you think you would like to talk first before Mom joins in?
Yeah, it's fine. Yeah. So
Okay.
I've been blacking out for the last 6 months now, and I seem to have these episodes like at least every month. And
Right.
this month, last month I've been having it now 3 times.
Right. Okay.
Yeah.
Yeah. And do you remember when it first started?
Yeah, I started I think 7 months ago. Yeah, I think
Right.
yeah.
Right.
If
You
I'm
had your first episode 6 7 months ago, and were you perfectly all right before this?
Yeah, I never used to pass out. Yeah, I never used to pass out.
So you never used to pass out before that. Okay, I
Yeah.
see. Um. Well, has anyone? Do you remember what you were doing at the time you passed out?
I'm not sure. I just what do you say? If I am like doing an exercise, starting to do an exercise, or sometimes it doesn't even. I need not what do you say? Exert myself. I just simply pass out sometimes.
Right. So
Yeah, it's
okay.
happened multiple occasions, and I don't remember exactly what I've been doing.
Okay. Right. So you don't notice any particular association with, for example, like you just said, exerting yourself, exercising. It happens
Yeah,
in
I
any.
think once it has happened while I was exerting, but there have been occasions when it has happened while I was not exerting. Yeah.
Right, right, right. Has anyone seen you pass out?
Yeah, so mom says, yeah, I've seen her pass out many times. Yeah,
Okay, okay, okay. And what do you see here? Well, how
yeah.
does she look when she's passing out?
So once I remember, for the last month I've seen her pass out like 3 times now. I'm like really worried, and we've been contacting GP. So what happened was the last time she passed out was just a week ago.
Right,
She was just watching telly on a couch, and then I asked her to go fetch me something from kitchen, and she
right,
just stood up and started walking towards the kitchen, and then just like dropped uh, then then and there. It'll drop like a fly.
right,
Yeah,
right. I'm sure that must have been very scary for you because obviously she's your child.
yeah.
It must
So
have been very worrying.
yeah, that's exactly why we're here.
Right. And does it always happen when she's like lying down or sitting, and then when she stands up, does she pass out,
So
or is it like,
so Mary says sometimes I feel my heart thumping before
oh,
such
okay,
events. Yeah.
okay, okay, yeah. So you notice your heart pumping. Do you feel anything else just before you're about to pass?
Um. I'm not sure. Sometimes it blacks out from. Yeah. I feel very what do you say, dizzy, and my vision gets blurry.
Blurry. And do you
Yeah.
feel like ringing in your ears, for example?
No, no, no. So
No,
mom
no.
says, she doesn't wake. I mean, even though she passes out, she wakes by herself up.
Right,
Yeah.
right. She wakes up by herself, and when she wakes up, how do you feel when you wake up?
So she feels a little under the weather as soon as she wakes up. Yeah.
And how long does it take for her to recover from these episodes?
Yeah. Then she's fine. And even though it happens, she's been fine. So I've been giving her. I sometimes give her something sweet to eat, thinking that if it's something related
Okay,
to her blood sugar. Yeah.
right, right. And do you think it
because
helps?
because my one of my siblings or my
Yeah,
sister, this is
yeah.
Jessica speaking. One of my sister
Oh,
is diabetic, type 1
oh,
diabetic. So
oh,
yeah.
I see, I see. And how is she? Does she have?
Yeah, she was young when she got diagnosed with type 1 diabetic. Yeah.
Oh, oh, I see. Okay, okay. So that's a very important point. Thank you for mentioning that. Also, you mentioned that you had thumping of the heart, you get blurring of the vision. Do you notice any headaches? Has anyone ever told you? Have you ever had any fits?
Jessica's never thrown a fit. No.
Oh, hasn't. Okay, that's good. That's good. And what about any do you have any um do you have any do you have any fevers associated with these episodes? Any infections?
No, never had any. And she's had occasionally like a viral snot, but nothing, uh, nothing related to these events.
Right. And do you feel like weird, do you have a weird sensation in your heart? Do you feel that it goes out of beat sometimes?
No, no, no. I
Right.
mean, she's never mentioned that. It's just,
Okay. Hasn't mentioned that.
yeah.
Okay.
So Mary,
And
Mary says, yeah,
okay.
sometimes I have these thumping episodes, but
Right. Right.
many times that's not related with these blackouts.
Okay, I see. I'm sure you're very worried about this, and this is very important. It should come down to the diagnosis. So why don't I summarize so far what you've said so that we don't leave anything out? So basically, your symptoms started around about 6 to 7 months ago, and
Okay.
the last time you had them was 1 week back, and in the previous month you had almost 3 episodes. You don't notice them with exertions, and they can come on at any time, and you don't have any funny feelings or what we call auras before them. And after that, you usually recover pretty fast, and you Say you have palpitations, thumping sensation of the heart,
Yeah.
and basically blacking out. You don't
Yeah.
notice any fits, or do you have any blueness? Does she ever go blue during her episodes?
No, she's never been turned blue. No, no.
You did mention one important point. You mentioned that your sister has type 1 diabetes. Am I right?
Yeah.
Right. When was she diagnosed?
Around the same age. So that was my main query. Yeah.
Right, right. So,
Yeah.
so that's your main inquiry. That's very concerning, actually.
Yeah.
And what do you know about diabetes?
Um, I know that your blood sugars are really high, and you give insulin and things like that. So I've seen my sister black out once, having at the similar age. I think she
Right,
had a lot of insulin and her blood sugar dropped. So
right, right,
I thought it's something related to that. So I just
right, right.
yeah.
Yeah, it's concerning for me because I'm not sure if and you've been informed before, but the diabetes is does run through family. So if one of your siblings has it, there's a greater chance that one of her siblings could have it. In this case, that could be you. So have you ever had your blood sugars checked before?
No, we've never had it. And
Right.
I noticed her to have lost weight as well.
Right, right. That's very concerning. And
Hello?
like you pee a lot? Do you feel like you pee frequently and yes?
No, no, no.
No. So you don't feel, do you feel very thirsty?
Mary says no.
Yes.
I don't. I'm not weeing out a lot. No.
No. And what about do you wake up frequently at night to pee?
Um, no. She's never had any of that. Mary says
Right,
no. Yeah.
right. And do you feel very thirsty and very hungry all the time?
No, nothing like that. No.
Right, right. Um uh right. So it doesn't the symptoms don't really add up to diabetes, but I think it'd be safe to it's best that we do organize a referral for you so that we can test your blood sugar. Um Also, um do you have any do you have a do you suffer from any major illnesses other than the symptoms you're talking about?
Um, and she is asthmatic, and we have
Oh,
inhalers. But apart from that,
right,
no, nothing.
right.
And
Is
she does a lot.
is her
She does a lot of gymnasts, and she's quite. She
good?
works out a lot. Yeah.
Okay,
Uh,
okay, okay. Okay.
she's otherwise very
Is her
fit.
asthma?
Yeah.
Oh, that's good. So her asthma is controlled. You have no problems from that.
No, 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 no.
Oh, okay, that's good. Okay, that's good.
Yeah.
Um, what
She is
medications does
a.
she use?
Sorry. Sorry.
Medication? What medicines does she use?
As I said, just the blue inhaler, and that's like
Oh,
as and when required. We don't use it very often.
and that's good.
Yeah.
Does she have any allergies?
No, no known allergies. No.
No known allergies.
No.
Is there any significant illnesses in your family other than the diabetes that your sister has? Like mom, dad,
Mm,
or the rest of the
um,
siblings?
I think the dad side, uh, and there's some seizures on the dad side, uh,
Okay, that's
but uh, but her dad and her dad as a child never had seizures, nor did I have a seizure.
okay. Right, right.
Yeah.
So, and do you have any other siblings other than the sister?
I just have one sister. Yeah.
Oh, that sister. Okay. Is she older
Mm.
than you?
Yeah, she's older than
All
me.
right. Okay. So there's no other illnesses. That's good. Otherwise, um, how is your diet?
Yeah. Diet. Yeah, she's a bit of a fussy eater. She's quite picky with the food.
Okay.
Yeah.
Right, right. Does she eat like a wide range of things? Does she like try to keep her carbohydrates, proteins, and fats in her diet,
Uh,
or
so
is she not?
Mary says, I'm not into spicy food.
Right. Yeah,
Yeah.
that's fine. All right. That's perfectly okay. Then what about right, so you mentioned you didn't have any allergies other than the asthma. What about her developmental milestones? Did she achieve them at the normal times?
Yeah. Yeah, that's all milestones
That's
she's
fine. That's fine.
achieved. Yeah.
That's good. And what about her vaccinations? Did she have them? Did she complete them?
Yeah, she's been jabbed. All her jabs are up to
And
date.
were they fine? There was no issues with them?
Yeah, no issues. Yeah.
That's good. That's good.
It's just this, I'm not sure. I don't know if she's a bit concerned. So, mom says, I'm not sure if she's a bit concerned with her body image. She hardly eats much, but she does eat, but quite picky with the food.
so you feel like are you just so Mary, what do you feel like your food, you must control your food limit? Like are you concerned about your body image and how you look to other people?
Yeah, because I go to like ballet and gym, yeah,
Oh,
because I
that's good.
yeah, so I
Oh,
need to
okay,
look
that's
good.
good.
Yeah.
So
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 time
so you feel that's very important to you.
your time's yeah. Okay, you time's actually up. Okay.
So as you can see, candidate did a fairly good job in gathering the information. So in that domain of gathering information, she should be getting a good marks. And coming to the discussion where the clinical reasoning is there were a lot of information with regards to the family history, with regards to the drug and the medication history, and with regards to the social aspects. Now, which of this is a red herring and which of this is clinically significant for you to summarize in your history to formulate a management planning? This will give you marks on your clinical reasoning. This will give you marks on your management planning, and that's how you tailor your history taking sessions in MRCPCH to meet standards. So the rest of the discussion follows our feedback and what else could have been improvised.
Differential would have been diabetes. She could have had that hypoglycemic episode. Another differential of mine could have been that this child is very obsessed with her body image, so this could be going towards anorexia. It could be anorexic. Another of my deities is that I would like to rule out a seizure disorder.
The history was quite adequate, but one thing was in my mind that her elder sibling was diabetic
Yeah.
and she was using insulin.
Yeah.
So might be she has some psychological issue, or that could be some, digged out, because if insulin is being used at home, so there might be some mishandling with insulin. I
Okay.
think
That
some
would
social and psychological history could be ruled out well, because she's having recurrent episodes of loss of consciousness. Maybe Munchausen by proxy or something like that. I'm not really sure, but maybe.
yeah. That's brilliant. That's
Oh,
very good.
this one.
Huh?
Yeah, but if there, I mean, that's a very good suggestion, good thought. But it is something to be. I would keep it as a last point. But suppose if there was an abuse of insulin, what else would have been there in the history, or what else would have been there in the presentation?
I think the history.
I mean, yeah, something in the presentation. If there was an abuse in insulin, yeah, and I would also expect insulin resulting in hypoglycemic seizures. The
Yeah.
child, yeah, I mean, it is very hard to imagine someone abusing insulin and never getting seizure. I mean, non-medical person.
What is the diagnosis here? I will tell you. Okay. The diagnosis here is.
So as you can see from the highlights of the discussion, there were constructive inputs, feedbacks given to the candidates, and the candidates did offer really good differential diagnosis and how to go about with the management planning. So how would you approach this case, and what a differential diagnosis would you keep in your mind, and how would you formulate a management planning, and how would you summarize your findings? So to find out, please contact us, log on to our channel, subscribe or comment, and we hope to see you on the other side. Thank you.